Welcome. Hi, I'm Rachel Dumanian, and I am Childhaven's Early Childhood Healthcare Integration Manager. Thank you for choosing to be part of this conversation with us about integrating services to promote equity. I'm pleased to introduce today our panelists, Jamila Jenkins and Yusuf Hai, Childhaven's primary care early childhood specialists. They are Childhaven employees who perform early childhood developmental screening and navigation for families at Odessa Brown Children's Clinic. We're also joined today by Dr. Kathy Park, a pediatrician at OBCC and clinic lead for the Family Navigator program there, the focus of our conversation today. Our hope today is to both inform and inspire you to shake up the status quo in service delivery and to improve outcomes for families. We are going to explore how Childhaven's collaborations with pediatric partners are addressing families' calls for a reduction of barriers and an increased sense of care and belonging across the early learning and healthcare sectors. But first, a few logistics and our roadmap for today. We are recording this program to make it available to you and to folks who couldn't join us, and I will share the slides afterwards as well. Childhaven holds these community conversations every few months to engage with various partners and to give people an opportunity to learn more about our work. Thank you to all who have introduced yourself in the chat. We'd love to see who's with us. During these conversations, we alternate between high-level, big-picture overviews and more specific conversations like today, where we highlight a particular program area. Today, we'll start with a panel presentation for about 25 minutes, and then afterwards, we'll open it up for more questions and discussion with all of you. Please feel free to use the chat for any issues that need to be addressed immediately, or if you won't be able to voice your question during the discussion. Our chat monitors will reply. So, what is healthcare integration? One moment. Yusuf, Jamila, Kathy, and I are just four of of a small and growing team at Childhaven focused on integrating early learning with pediatric primary care. This work started as a collaboration between Harborview Pediatrics and Childhaven in 2018 to increase the clinic's capacity to support children's developmental and behavioral health needs, and Childhaven's strategic mission to bring services closer to families where they already are. We've now expanded to include partnerships with not only Harborview, but also Odessa Brown Children's Clinic and Swedish Pediatrics, as well as relationships at the Washington State Healthcare Authority, HealthPoint, and more. The visual you see shows our developmental specialists, healthcare partners, and Childhaven program leadership involved in this dynamic work, many of whom are here with us in the audience today. Childhaven's healthcare integration strategy is guided by community input that shows that caregivers of young children want more coordinated and centralized access to services. They want a reduction of barriers and complexity of systems, and they want an increased sense of community and belonging. To do this, Childhaven is creating partnerships with local healthcare partners to increase clinics' capacity for supporting the behavioral and developmental health of young children, and to improve access to support services for families. So now I'll turn it over to Dr. Kathy Park to talk about what these desires look like among her patients and why OBCC and Childhaven are partnering to focus on developmental screening and promotion within the pediatric primary care setting. Kathy?
Thank you, Rachel. I can't see any slides on my end. I don't know if that's just me, and I'm happy to go on if that is just me. But I'm really happy to see you all today. Good morning. My name is Kathy Park, and I'm a pediatrician at the Odessa Brown Children's Clinic, and I like to say I have the greatest job in the world. I get to spend my days working and learning from the brilliant kids and families at OBCC, where I've practiced for the last 20 years. And babies, right? They are my favorite. I continue to be in awe of them, alert, wide-eyed, absorbing all, and at the very start of their life journey. This project was born out of a desire to improve the processes and outcomes of developmental screening in pediatric primary care, and a desire to bring to the forefront the things that Rachel told us communities want. We understand how critically important the early childhood years are for brain growth and development, with some studies finding that 90% of brain growth occurs in the first 5 years of life. Overall, approximately 12 to 15% of children experience developmental delays in language, cognitive, motor, or social emotional development. Early identification is critical to making gains, yet only 10% of children with delays are identified and receive intervention. Furthermore, large segments of our kids are being left behind. Compared with children living in an English primary language household, those in non-English parent language households are 40% less likely to have received screening in the past year. Those figures are staggering, and we have to ask ourselves, why would this be? I'd like to share with you how things look from my perspective as a primary care pediatrician. I noticed that I have a 3-year-old boy on my schedule coming in for a well child checkup. They arrived 20 minutes late for their appointment, and I hear that the family had to take 2 buses to get here. I see that mom also has 2 other children with her today. The family speaks Oromo, and I am lucky to have an in-person Oromo interpreter for today's visit. The folks at the front desk hand mom a questionnaire to complete. It is in English. I listen when she says she's worried about her child because he's not yet speaking sentences and people can't always understand him. And he is still having disruptive tantrums. Today is a good day for him, and I notice that the boy is funny and smart, charming. He shows me how his transformer toys work. I notice that she has not answered all of the developmental screening questions on the paper, and we tried to go through it together with the interpreter. Listen when in response to a question, mom says, "But our family doesn't ever scoop applesauce from a jar." I try my best to explain the skill that we're trying to assess. I refer the boy to Childhaven to support his speech and language development. The boy has turned 4, and I see him at his next well child checkup. I hear when mom tells me that she tried but never connected with the school district last year. I hear when she tells me that his speech is better, but still behind his peers. I listen when mom tells me she is also worried about his behavior. He is easily frustrated and has angry outbursts that are hard to control. I refer him again to Childhaven, and I'm also referring him for behavioral health support. I involve social work and care coordination. I make phone calls to the district, mental health organizations, and everyone from the clinic and the district and the family is working hard to try and help, but we are not well connected, and there's poor coordination across our systems. Our boy is now 5 years old and starting kindergarten. Due to mom's sheer will, strong advocacy, and persistence, the boy is receiving speech therapy, but it was not started until just a few months ago. I notice the mom is still worried about her boy, and the boy is sullen. I listen carefully when mom tells me that her boy is always getting into trouble at school. He gets removed from his classroom several times a week for disruptive behavior, and his name is on the board with a red dot next to it. I listen as she explains that kids get green, yellow, or red dots next to their names based on their behavior. And he always has a red dot next to his name. Notice, I hear, listen, and I feel my heart breaking again for another child that our systems have failed. I wish I could say that this story was atypical, an exception, or a one-off, but this is happening in clinics across the county, state, and nationwide. So have any of you out there felt a broken heart or maybe another emotion like frustration or anger or weariness. If you have, raise a hand or say yes in the chat or put in another emoji face of something else that maybe you felt. Because of systems that work in silos and fail families, because children and families are not centered in this work. I see you, I hear you. But today's talk is not about failed systems or hearts breaking or the status quo. Today, we are excited to tell you about a new program that is transforming the way we serve our families' needs. In 2021, OBCC was thrilled to join, learn, and build upon the foundational work of the Harborview Childhaven partnership. You will hear about harnessing the brilliance and power of families, giving space and support for our most at-risk kids to grow and become the shining stars that they are meant to be. I'm delighted for you to hear from the people who are central to the work of connecting systems, breaking down barriers, and reflecting back the strength and abundance of families. Our early childhood specialists, Jamila Jenkins and Yusuf Hai.
Thank you so much, Kathy, for sharing and highlighting, the challenges and struggles that many diverse families face when trying to access support services. Again, everyone, my name is Jamila Jenkins, and I'm one of the primary care early childhood specialists working to do developmental screenings at OBCC currently. After obtaining my degree in medical anthropology and global health, I obtained a better understanding of the complex determinants of health and how important it is for families to be seen, heard, and represented in the systems that they're a part of. After working on a pediatric, psychiatric, and behavioral medicine unit, I saw how many families were in crisis with no support systems in place to offset the adversity that led them to crisis in the first place. I joined the Family Navigator program because of the innovative way that we are addressing and supporting families during early childhood. This upstream approach uses a three-pronged method to support families and young children during early childhood. One of the first things that we do as developmental navigators are developmental screenings. We focus on early relational health, and the screenings consist of normalizing childhood development for families while informing parents of ways that they can support the physical development and social emotional development of their children. The screening tools that we use are the Survey of Well-Being of Young Children, and we specifically chose this screening as it can be adapted to a family's culture and language. We also use the Social Determinants of Health, which is an important questionnaire to make sure families' social needs are being met, because a family can't focus on their child's development if they're worried about where they're going to sleep for the night. And we also what makes our developmental screenings different and what makes this program different is that we use an interview format when we talk to families. We're asking them questions so that we can adapt screening questions for clarification, understanding, and cultural relevance. The second thing that we do as developmental navigators is provide support, parent education, and developmental promotion. Using the Promoting First Relationships lens to provide reflective observation and feedback to parents during our visit with them, we emphasize the strengths that we observe and the ways that parents are supporting, guiding, and nurturing a responsive relationship with their children. Developmental navigators then give parents activities that they can promote their children's development while nurturing reciprocal interactions to enhance behavioral and emotional regulations in their infants and young children. We also then provide families with support on finding community resources that are close to them or just things in the community that they can become a part of. And then the third thing that we do as developmental navigators is case management and advocacy. This is part of the program where we focus on advocating for families' rights within a referral system, connecting systems, breaking down barriers to make sure that systems are working for families. We help families access the resources in a timely manner and make sure that resources are available to families in the language that they prefer. From all of this, I kind of want to just share a way or an example of how my work has broken down unnecessary barriers for a family in particular that I was working with. Recently, Not recently. I just helped finish working with a family this last month, a Spanish speaking family who needed assistance getting their 3-year-old enrolled in support services through their school district. This family had concerns with their child's language development at 18 months, and the family brought this concern up to the providers and saying that their child could only say about 6 words. The primary provider assured the family that this was normal development and that the child was seen at other well child visits, and the problem persisted and it just kept coming up. It wasn't until the child's 3-year checkup that the providers took the parents' concerns a little bit more seriously and referred the child for a speech eval as well as a neurodevelopment eval at this point. At 3 years old, this kid was diagnosed with autism and a speech delay. So as a developmental navigator, I was able to step in and advocate for this family to not have to go through unnecessary screenings when they were trying to connect to support services through their school district. I was able to advocate for them to go straight to an evaluation instead of having to repeat forms and screenings that they had already done. That was just one way that I helped this family overcome these unnecessary barriers and get the services that they need. I'd love to share and pass it over to Yusuf now to share a story and share kind of way that he is also connecting with families. So Yusuf, would you like to share?
Thank you, Jamila. Hi, everyone. My name is Yusuf Hai. I work as a primary care early childhood specialist at Odessa Brown Children's Clinic as well. So I provide a culturally appropriate developmental screenings to parents and caregivers of young children. My background is Bachelor of Education in Education and Psychology, and in my past roles, I worked as a social worker and child protection officer and home visitors as well. Also, my work is focused on helping families understand and meet their kids' developmental milestones. There are additional roles I play as well. One additional role I play is I provide psychosocial support to families of many of whom facing instability in their lives. And in our work, we have learned that a family's basic needs must be met for the family to support the developmental milestones of their child. I would like to share a recent example from the journey of a family that was recently in my care. This family had moved to the United States in 2021 from Ethiopia. The family was living in a homeless shelter in Seattle and had concerns with their child's development with a 2-year-old boy. Listening to them and understanding what their concerns for their child and their social needs helped me fully support the family. I first connected the family with a social worker who was able to help them apply for Section 8 housing, and also move them into like a stable housing and help them find a job. I then helped the family by connecting them to a Facebook group and other community resources that offered family furniture, while also connecting mom with the Ethiopian community in Seattle area. Once the family's social needs were met, I was then able to help mom or them address the developmental concerns that the child had. I connected the family with early support for infants and toddler service through Boyer and found an early Head Start child care center for the child to attend while mom went to a new job. This example illustrates the priority of providing holistic care to families based on a particular family circumstance. Listening deeply, understanding them, building trust, and offering resources that meet the family where they are. Screening for developmental milestones cannot hold its value if the family's basic needs are not met. Prioritizing these needs is vital to the child's development and will allow families to continue to work on a better quality of life with their children and communities in the future. Based on this, recently we conducted a caregiver survey to see how we're doing and parents' feedback. As you can see on the screen. So 38 caregivers who speak in 7 languages who had spoken recently with Childhaven Developmental Navigators prior to their completed 12 questionnaire survey online or by phone. And it was really wonderful to see parents from different culture feeling supported. Yeah, thank you for listening, and I'll take it back to Rachel.
Thank you, Yusuf and Jamila and Kathy, for sharing your passion, your experience, your goals in this work. The work that you describe really demonstrates how integrating the services of an early childhood organization and a pediatric primary care clinic can help create more equitable access to services that help children and their families thrive. We're about to move into discussion, but because of my technical challenges earlier that you were also patient with, I'm just going to take one moment to take us back to the slide that shows the other members on this team. So just bear with me for one moment while I flip back, because I do think it's important for you all to see the large network of those supporting this work already. So this is the screen that I meant to show when I said that this is our new and growing team of Childhaven developmental specialists, healthcare partners from many different locations in King County and beyond, and Childhaven program leadership also involved in this work. Many of these individuals and our teams, and teams within their healthcare clinics are here with us today. And so I also bring this up to lean on many of my teammates for the question portion that we're about to enter. So thank you for bearing with me through the technical difficulties, and a huge acknowledgement to the team that supports this work. So we are now going to move into discussion. In this session, we have a wonderful variety of attendees with us, from partners to community organizations, funders, donors, and other fantastic contributors to this work and associated projects across the county and throughout the state. So now we would love to hear your observations, your questions, and your comments. Please use the raise hand feature or just come off mute to speak. If you'd prefer to put your question or comment in the chat, one of our chat monitors will read it. Who would like to begin by sharing an observation, a question, or a comment?
I can share. I get a little teary-eyed when I hear about the work that you all do, because I know it's just so important and meaningful. And so I just want to really reiterate just how valuable you all are. And I'm so hopeful that eventually this model will be the standard and the norm, so that whenever a family is dealing with a homeless shelter issue or concerns, they have someone to turn to like you all.
Thank you, Kendra, and thank you for the work that you do in your research to demonstrate the importance of these different roles in a primary care clinic and work towards transforming pediatric primary care. Marlo, I see your hand raised. Would you be willing to come off mute and share?
Hi, my name is Marlo. I work over at United Way of King County on a lot of our eviction prevention and rent assistance work. And I'm just sort of wondering, you talk about the lack of connections, that are systemically and how they impact people. I'm wondering with the families that you work with, when people have are facing housing instability, are you pretty much at the mercy of the general rent assistance world and housing stability, like rent assistance programs out there? Or is there, do you have like a pot of money that you're able to help families that are facing housing instability? Or do they just have to kind of call like everybody else in the community? Because it'd be great to figure out a way to sort of link all of that together instead of it being siloed.
Can I ask whether maybe one of our partners from OBCC or Harborview, maybe Abby or Kathy, you could speak to how your clinics address some of these needs in families and or
Sure,
great, thank you, Kathy.
Yeah, I can speak from Odessa Brown. Marla, thank you so much for your question. I'm looking for you on my screen. Such a good question. And I really wish I could tell you we had this extra pot of money that we were able to support our families with when they're facing housing instability and insecurity, but we don't. And most of our, and Yusuf talked about this already beautifully, but I would say the support comes with just helping families connect to the resources that are out there. So information and just kind of staying on top of it. So staying on, making sure, like being persistent, like still on this list, still on that list. And I love your idea of creating better linkages to those community partners to maybe think of things in a different way besides just getting on another list. And I feel like that is a lot of what this work is about, is thinking about like, okay, I'm certainly not in this world, but there are people who are in this world. They're in our community. They can, we should be partnering in a lot more creative ways than we currently are. So thank you for that. Abby, do you have anything else to add?
I think you captured it all, Kathy, really well. I think our team really recognizes how things like housing instability impacts family stress and are really challenged to meaningfully support families. I think both of our clinics have social workers and medical legal partnership models, which are helpful. And we recognize that that's unique to our clinics and not every clinic even has a social worker. I do think Jahmela and Yusuf and Fernanda and Farhio's relationship building over time with families and them being a safe space where families feel like they can just share how hard it is to be facing homeless situations or just insecure housing is in some ways just supportive in itself and helps our whole team know that that's an issue for the family.
Just to add from like a family navigator's perspective, in my case, I think the biggest challenge is the system where I was giving, recent family that I was working with. So this family doesn't speak the language, and also like they don't know how to navigate like, these resources. So our part is mostly like kind of advocating, connected them to those resources and, just a lot of like, follow up in case management. Yeah.
I can kind of share too, just a little bit more from what Yusuf just said is I recently was working with a family and they were receiving assistance from the state. They were in state custody, but the family still needed assistance with housing. And so my job there was to act as an advocate on the family's behalf to talk to their case manager and say, hey, this family still has this concern. Why is this not being met yet? And so I was able to push that along. So sometimes we don't necessarily have the direct access to resources, but the relationship that we build with families helps us to act as an advocate on their behalf or with them to get connected to services better.
Thank you all. And what rich answers that led to. Thank you, Marlo, for that question. And I love seeing the questions that are coming into the chat. And we are going to address a couple of those. Let's see. I see this question here about, I'd love to hear more about how you've adapted developmental screenings to be culturally responsive for different families and communities. Emily says that when she worked in a home visiting program, she found that that was the biggest barrier to getting families to agree or to seek out regular screenings. I wonder whether, Fernanda, are you available to talk about this for a moment?
Yes. Hi. So I am Fernanda Martinez Novoa. I'm one of the developmental navigators at Harborview. And when Family Navigators program started at Harborview was already using the SWIC, which is the tool that we use. They chose SWIC for different reasons. And one is because, as Emily says, other tools have like barriers in the way they ask questions, like they're very specific about things like using forks. In some cultures, they don't eat with utensils, or things that like children are never exposed to because it's not part of their culture. So SWIC is a shorter version of other developmental tools, but it is not as specific. Like I think it is very aware of the differences in cultures. That's one thing. The other thing is SWIC is translated to multiple languages. It includes Somali, Spanish, and for the Somali translation, Harborview played a big role there. There was a team working and making sure that the way these things were translated makes sense. Because, for example, their expressions in, so the question itself in SWIC, if you translate it, you know, as it is in the developmental screening, it wouldn't make sense in another language. For example, Somali, and I'm saying this because Farhio told us like there is not any specific there's some specific like words that they don't say toys, I think it is. So you have to really adapt that word to something more specific. Or for example, things like in Spanish, in English, something like more water could be 2 words, but in another language, it wouldn't be 2 words, or it's something that children's don't learn, you know, in their context. So just adapt these questions in a way that when we ask, if we are asking if the child is able to say 2 words, it makes sense in their own language. So yeah, that is the adaptation to cultures that this tool makes. And also I think part of this program is that we not only use the tool, we're not handing out tools for families to complete. We are there for families, and when they don't speak English, we work with interpreters. So oftentimes I ask the interpreters, for example, like if they have plurals in their language. I remember this time that the interpreter was like re-asking the question, and I said, interpreter, do you have plurals in your language? And he said, no, we don't use plurals. So the question didn't make any sense in their language. So I think that's part of also of adapting to the cultures, and it's not just the tool, but the way that we deliver services, and is making sure the families are understanding, the interpreter is understanding, and if there's any miscommunication, we can solve it immediately. So the family can answer to the question as it is intended to be.
Thank you, Fernanda, for providing that depth of information. I think that was some of what just blew my mind when I first learned about how the screenings were being delivered and how much need there was for this conversation to adapt them, because what does that mean to to ask if your child scoops applesauce with a spoon if the family's not eating applesauce, right? Or what does a child not being able to say plurals mean if there's no plurals in their language? So thank you for those great examples, Fernanda, and for that question, Emily. I want to turn a little bit of attention toward Jenna's question about the Healthy Steps model through 0 to 3. Thank you for bringing that up, and Jenna, we'd interested to hear more about your interest in that. Kendra, thank you for weighing in. This is all in the chat, folks, but Jenna wonders how this is similar to the Healthy Steps 0 to 3 model, and Kendra explains some research on Healthy Steps and how it's important to be adapting models to each clinic as well. And I just really want to take this chance to say that we really admire the Healthy Steps kind of approach to putting a navigator type role, right? A not licensed necessarily, but a really knowledgeable early childhood professional in the clinics. And that's totally what we're doing with our navigators, as well as with our early childhood specialist at Swedish Edmonds. So Yvonne Lara is on the call, and I'm going to give her a moment to speak about what she's doing up there. And as you listen, you'll hear that Yvonne's work is slightly different at Swedish Pediatrics Edmonds. But that came about really because of this desire to look at what a clinic, like the services that a clinic already has, the capacity that the clinic has, the patients that are being served in each location, the desires of the patients, and put in a slightly different role based on all of these local factors, right? And what families are asking for. So Yvonne's role was actually modeled a little bit more closely to the Healthy Steps program. So Yvonne, do you want to take a moment to explain what you're doing up there?
Yes, hi everyone. It's so nice to meet you. I am the early childhood specialist, like Rachel said, at Swedish Pediatrics. And I have a wonderful opportunity to work with 5 different pediatricians there. And I am working and specializing in the birth to 5 population. The referrals that come through from the pediatricians can range from attachment to supporting parents through tantrums, sleep difficulties, areas of sensory, toileting, really just trying to, a little bit of case management sometimes with helping to connect families with some services. And that could be some behavioral health services or OT, and working collaboratively with the pediatricians to make sure that we're all on the same plan as far as supporting the child and the family, and that it's representative to their culture also. This is a new role for me, so it has been going really well, very busy. But because I specialize in the birth to 5 population, that is where my primary work is. And there is some referrals that come in for trauma because I'm also specialized in trauma. And sometimes the trauma can also be medical too. So I support with that also.
Thank you. And thank you for the questions that continue to come into the chat, and John and Abby and Kendra for the responses that are coming through in the chat. Abby, is there anything that you've been able to express in the chat that you would like to be able to voice or elaborate on?
I feel like I always have too much to say about this project. I think compared to some of the other models of integrating community health workers or developmental specialists into medical homes, I think the part that is most unique about this is that it was really co-created with Childhaven and a medical home, which includes Odessa Brown and Harborview. And so most of the models sort of have it embedded within the medical home, and then the family navigator, early childhood specialist works to connect with the community organization. And so there's lots of relationship building, but it's pretty unique to have kind of the close-knit collaboration that we have with our team. And part of that is really that healthcare and education have typically been so siloed, and that we don't understand each other's systems, and we each talk about the barriers on the other person's end and don't sort of see each other, understand each other, or learn together. And so a big part of our work and energy is to do that differently and to really learn together as a team, and to have parents and families hopefully experience less barriers and less duplication, and more that health and learning and being cared for is in both places. So I think other models definitely do parts of that, but I think that's really foundational to what we are trying to do.
Thank you, Abby. John has been doing such a great job responding in the chat, and I'm going to open it for any other audience questions that anybody wants to voice.
I will share with all the work that has taken place over the years at the Odessa Children's Clinic, and with this amazing work that is taking place now, and I'm sure it is going to spread because it just makes sense and it's humane. Is, you know, one of the factors we talk about relational health and relational health. You heard amazing examples of the Navigators and work building trust with families, et cetera, and it is as important to build that trust with our partners in the health homes. And there'll never be enough navigators. There's not enough mental health therapists. And so that's not the answer. It's not just about embedding, as Dr. Abby just said. It's about what is that kind of, you know, slow cultural change within health homes and primary care clinics that will allow our medical partners to have a bit of a different stance, so that we can all, as a team, deal with these social emotional issues using the same language. And it's a challenge. It's a really good challenge, and we found that to be so helpful. And Kathy Park was, you know, and others on this in this meeting were a part of that. But how do we make this a shift of that paradigm within the medical world? And I don't mean a drastic shift, but a shift of being more reflective and open, and maybe not having all the answers all the time in a short time period with families. I find it magical, and it's and I will always find it to be magical and revolutionary.
Thank you for sharing, Mark. You inspire me. This work that you guys all do is really important. I just people are mentioning, you know, we have these silos, and, you know, we all need to work more collaboratively together. And one of the things that we're doing at Hope Central and with VFAB that is kind of more pertaining more to autism is we're kind of experimenting right now, but having and developing this cultural navigator, and we also have clinical patient navigator. This is kind of thinking about around a family who has a child with a new diagnosis of autism. And if you think about the same story like Kathy was sharing, you know, you connecting to services. So I'm going to use a Vietnamese family who has a language barrier, who's not able to connect to these services. I had one patient who came to me and they said, you know, the school says this, you know, my child needs to be evaluated for autism. And I said, well, you know, let's establish care and let's see how we can, you know, we'll have you come back and bring your paperwork. So then, you know, next thing I know, they come back in like 2 months and stack of paper that I got. And I looked through and I'm like, oh, wait, you actually have a diagnosis of autism early. And I'm going to make a copy for you. This is really important. Give this to the school. Now your child's going to get some services, and this one you keep. But that's an example of how, you know, families are getting lost. And so we're kind of looking at some core services that we want these families to be connected to, like DDA, ABA, IEP, speech, OTPT, and then kind of some ancillary services. Like we heard about how, you know, if we aren't able to help a family with other needs, that trust doesn't get built. So so here's some extra ancillary services. Let's have you pick one or two that we can kind of help as well. Like if it's like, you know, food stamps or something. And I know I just love this idea of being able to collaborate and share. So I'm just sharing kind of what we're doing and how we can all have this partnership together. I have Tammy on as well. She is part of our team, who is a cultural navigator that we're developing. And so I'm just grateful for all of this work.
Thank you, and thank you for telling us about your work. Really, like this is new, this is innovative work, and we're eager to be learning with and from you. And so thank you for bringing that up. It really is, like you said, about breaking down the silos and connecting partners, connecting organizations, connecting people to help families. You see, we have a lot of people off camera and on mute. Does anybody who's off camera want to share? I see multiple questions in the chat about interest in scaling and funding for these things. Yes, it does mean that additional scaling is an interest, and scaling means additional funding is needed. So Childhaven's healthcare integration strategy actually involves not just the Family Navigator program and even the Early Childhood Specialist program that Yvonne spoke about, but we picture this work in multiple directions. So what you've heard about largely today is our interest in bringing early childhood development, early relational health into pediatric clinics where families are already seeking care. We also think about it in the opposite direction, so bringing pediatric primary care into early learning settings, and that's a future direction of this work. But the third part of it is really about policy and systems change to support this at a larger scale. So like Mark said, you know, right now it's wonderful to hear the stories of the families that do get to be working with Jahmela, Yusuf, Fernanda, Farhio, Yvonne, and that's not anywhere near the number of children and families who would benefit from this work. And so to support both providing this kind of role in more clinics, but also to support clinics being able, you know, our larger system focusing on early relational health and all sorts of behavioral health supports for families and children takes a lot more change, and a lot of that is new funding streams because our old ones aren't cutting it. So let's see. Abby, do you want to speak to kind of how, or maybe John or Mark, to sort of future directions for exploring sustainable funding?
I'd be happy to just say a few more words. Hi, everybody. It's John Gould. I have the honor of supporting community impact and government relations at Childhaven, which includes being part of this wonderful team. First of all, Jamila, Yusuf, Rachel, Kathy, so good, so good. Really, really informative and moving and truth-telling. So thank you all. Yes, you know, sustainability and scalability are both goals As Rachel said, it's going to take system change, but we wouldn't be here without Best Starts for Kids and Best Starts for Kids incentivizing system change by funding innovative work. And so for those of you connected with Best Starts for Kids, please know we see you and we appreciate you being here today and everywhere you are in King County, because this is just a small slice of a lot of innovation that's coming from Best Starts. Kids and families deserve this in every county of the state and every state in the nation, and we have a lot of work to do. You know, the big lever is Medicaid, and we're doing health and early childhood development services. We're reducing future healthcare costs by this work. So we need the big payer to recognize that. And, you know, there's some slow work going towards that direction, but as Rachel said, we need to be really actively a part of it. I want to just address Fatima's question in the chat, if I could, and then give it back to Rachel. But Fatima asks, how do you all balance the needs of multiple organizations and organizational structures in the partnership? Given you all are so busy, like, how is this big, beautiful thing managed? Well, first of all, thank you, Fatima, for asking that question. You know, it is managed by each entity putting some real time into it. So we have buy-in from Harborview's, not only supervising pediatrician and Dr. Grant, but Harborview's structure. We have buy-in from Odessa Brown Children's Clinic, not just the participating pediatricians, but the clinic leadership. Childhaven similarly has that contribution. You know, Rachel is not a direct service provider. She's a project manager. So she creates a sense of partnership, of team, compliance, data, evaluation, all those things that are needed for innovation. We do have formal MOUs. I mean, I'm happy to share those. They're formal MOUs between Childhaven and the primary care settings. They are values oriented. They start with shared values, but then we address patient confidentiality and other particular dynamics. And, you know, I think as Dr. Grant said, we believe that we're stronger because we're in partnership. In other words, an early childhood organization like Childhaven does not have the eyes and ears in primary care to do this kind of transformative work. And primary care settings were frankly not organized and set up to do really strong early childhood development work. So we believe we're stronger together, and that's why it's worth the time and energy that goes into the management, into the partnerships.
Thank you, John, and thank you, everyone, for these wonderful questions. We don't want it to end with this hour together. And so we would love to continue to be in touch with you. There's really a Zoom room full of people with experiences that we need to learn from, people doing similar work, people doing work that we would love to coordinate with. Marlo, I would love to hear more about your work and the other BSK initiatives you're referring to. That let's keep this conversation going. As John said, I get to think about and coordinate and connect with as my full-time job at Childhaven. And so I would love to meet with you if you would like. I'm just gonna start wrapping it up for now so that we don't hold anybody over, but I'm also happy to stick around a little bit afterwards if you wanna chat even now. Just to bring it back together though, we are so grateful that you decided to spend some time with us today. I know that, as Fatima said, busy schedules here, but busy schedules for all of you. So thank you for spending some of that time with us. Thank you for your observations, your questions, your comments, and just your attention. Healthcare integration is new and it's a growing strategy for Childhaven and our partners. And we benefit from learning with you. So on screen is a glimpse at our upcoming year's healthcare integration work, which includes both sustaining and expanding current partnerships and developing new ones. We're also interested in, like I said, influencing systems to support innovative, integrated, and equitable care for children and families everywhere. Finally, as John said, our healthcare integration projects are funded largely through public and private grants. For example, Family Navigator is supported largely by Best Starts for Kids. We have other generous funders in the audience who are supporting this work, the planning, the services, the research and reflection on it all. But to sustain and scale this work, we really are committed to supporting policy and systems change to fund more of it in a longer term way. My email is on the screen. Please feel free to reach out. We also have a Childhaven's Twitter handle because many of you had already submitted great questions prior to this event, and we didn't even get to that many of those. My thought was we'd come back to them if we were falling flat on questions today, but there's just more to talk about. So feel free to go to Twitter for that. I'm also going to send out shortly, at least by the end of the week, the recording of this event, the slide deck that you eventually got to see most of, and the questions and answers that did come in via Eventbrite if you are not a tweeter yourself. So please keep this conversation going. You're always welcome to reach out to me. Also, we encourage you to be on the lookout for Childhaven's next community conversation. And if you enjoyed this one, think about who else might want to hear about the work. So we'll end the recording now, but I can stick around for a few minutes in case you have any additional questions or ideas to share. And one final huge thank you to our presenters, to Yusuf,